everybody. I'm so glad
Okay.
to see the toilet.
We're good. All right. Well, welcome and thank you for joining the SIH Second Act staff today. I have Kayla with me in order to make all of this run. We're so grateful for her. Today, for those of you who haven't met me, I'm Kelly Corner and I am the new health educator. So while we're doing virtual classes, I will be the one trying to do an introduction and get us all on the same boat. All right. I do want to thank our members for joining today. And if there are any new members, I want to encourage you, share the information with your friends, get them onto our Facebook site and be able to watch all of our virtual classes that we have. All right. Couple of technical things. There is a little button down in the corner of your thing that says chat. And if you want to click on that, you can put in a chat message. You have a question for our speaker today. You can type that in and we will cover that when she is done presenting. All right. We do have some upcoming classes. Tomorrow we are doing our Enter Chai class, kind of a Tai Chi class, one of our series of exercise classes we're offering. So if you still are interested, you may feel free to sign up for that. That'll be this Friday and a week from Friday. All right. Next week, if you look at your newsletter, you will see we have several options going. We have our fall feast, and we will be in our new test kitchen, and we will be doing some cooking in there. And then we have following Friday, the 22nd, we have healthy snacking with our extension office presenting. So we have a few more things this month, and then you'll be able to see what we have on the lineup for November. All right. Remember Millie. Millie, we love Millie. You all love Millie. She will be back and in rare form, ready to get you guys signed up because it is that Medicare and re-enrollment time. All right. So feel free to give us a call. You've got our number. You know how to be able to sign up online for things. So get a hold of us, please. And then I would like to introduce today's speaker. All right. Today is National Mental Health Day. And we have been doing a series of autumn assessments on screenings. So we've told you what health screenings are. We've talked about cholesterol screening. And with today being National Mental Health Day, all right, we have the new program director from the Center for Senior Renewal, and her name is Laura Herzog. Did I say that correctly?
Herzog.
Herzog,
Like,
all right. And she will be presenting on screening for depression today. So Laura, thank you so much for joining us. And if you'd like to go ahead and share your screen, we can get started.
well, hi everybody. My name is Laura Herzog, and I am the new program director for Center for Senior Renewal. And as you know, as we're talking about, it's National Mental Health Day, and I've been asked to speak with you all today about depression. This is my first time doing a live Zoom presentation, so you'll have to bear with me, working through all the bugs, feeling a little awkward. Um, so we're going to talk today about the basics of depression, and you guys are all going to have an opportunity to do a self-screening. We're going to talk about ways to support yourself and others to help build resiliency and to boost mood. Resiliency skills are life skills that help us no matter what the state of our mental health. And with the pandemic, many people have really been struggling with their mental health. You know, part of this has to do with the increased stress and isolation that the pandemic has brought about. And part of it also has to do with the breakdown of typical resiliency skills that people engage in and maybe don't realize what an important part these skills play in maintaining positive mental health. I'd like you to start by thinking about low mood as if it's on a continuum. So on one end, there's what we call normal sadness. And this normal sadness that is sadness that comes and goes in life for short periods of time, maybe an hour, maybe a day. It's part of normal variation of mood. You know, maybe we have an argument with a friend, or we get negative feedback from our boss at work on something we need to correct, or we're just having kind of a blue or a blah day. And if we start to move further down that continuum, our mood can progress to mild, moderate, or severe depression. As we go further down that continuum, the mood becomes steadily more low, more persistently low, and the other symptoms of depression start to become present. And it becomes a lot harder to pull ourselves out of this mood with what usually works for us. And this is where health providers begin to talk with patients about how depression is not the same as sadness. That it's not the same as that sadness that occurs with normal variation of mood. Depression affects not only how you feel, but also how you think and how you behave. So depression is a medical condition in which brain chemistry changes. It interferes with our daily life and our normal functioning. It's a feeling of persistent sadness and a lack of interest in life, but it also causes a variety of physical and emotional problems. So depression increases the stress hormones in our body that are linked to cardiovascular disease. It impairs our immune system, so we're more vulnerable to infection. There are many medical conditions that coexist with depression besides cardiac disease. These are autoimmune disorders, Parkinson's disease, stroke, cancer, diabetes, kidney disease, and arthritis. In treating depression, we also improve our management and recovery from these other conditions as well. Now, depression has increased in prevalence with this pandemic in the United States. So the older statistic is on your screen here, that about approximately 15 of every 100 people would suffer from depression at any given time in the US. More recent surveys are showing that people are self-reporting depression in higher numbers. Now, when we're talking about older adults, there are certain factors that put older adults at risk for depression. These risk factors are having a chronic medical condition, being disabled, poor sleep, being a woman, being lonely, or socially isolated. You're also at greater risk if you have a personal or a family history of depression, if you use certain medications, if you suffer from brain disease, if you misuse drugs or alcohol, or if you've experienced really stressful life events. So stressful life events could be the death of a loved one, a medical crisis, caregiving for someone with a chronic medical condition can be very stressful. So if you think about all these risk factors, most of them in some way kind of push against or undermine our resiliency. Now, there's a lot of myths about depression. Now, to be clear, depression is not a normal part of aging. Most older adults have increased stressors, but they are not depressed. They're doing okay. Depression is not a sign of weakness, nor is it a character flaw. When we go through stressful life events, it is really normal to feel uneasy, stressed, or sad. And when we're grieving, when we've lost someone or something that is very important to us, we frankly can just be overwhelmed. Now, in these situations, after some time and adjusting, most older adults feel well again. Depression is different. We can't just kind of snap out of it. It's a medical condition that affects us more deeply. As we've discussed, depression affects quality of life. It makes us more vulnerable to develop other physical illnesses, and it can lead to suicide. Many older adults with depression need treatment to feel better. Putting aside some of these myths and the stigma associated with depression allows people to engage in treatment more readily and get the help that they need. So I wanted to kind of go over the basic symptoms of depression. I'd like to break them down into 3 general areas. Symptoms that are physical or in your body, symptoms that have more to do with your mood or how you feel emotionally, and then symptoms that have to do with your thinking. So when we're talking about mood symptoms, we're talking about feelings of sadness. It could be irritability or at times anger, tearfulness, a real loss or lack of pleasure in usual activities. So people often describe this as, I just have the I don't cares. I just feel like I can't be bothered. doing things that I normally like to do. So remember, we were talking about body symptoms being part of depression. Now, these body symptoms have to do with changes in sleep. So either too little or too much. People can really struggle with insomnia when they're depressed. You can see a complete reversal of your sleep cycle where you're up much of the night and you sleep most of the day. Or you can have people who sleep most of the day and most of the night. You know, they sleep all night, but then they also sleep all day to escape kind of how they're feeling. We see oftentimes changes in appetite. Again, it's that too little or too much. Some people eat to comfort themselves and then they find themselves gaining weight. Other people have little interest in food, that lack of pleasure, just in poor appetite, and they find themselves losing weight. The last set of symptoms, we're going to talk about changes in, actually, I'm backing up. We're still on body changes in physical activity. So some people get feelings of restlessness where they just feel like they can't keep still. They have to keep doing things. They have to keep busy. They just feel very restless within their body. And other people struggle with the opposite. So decreased physical activity, that, you know, even any movement is just too much effort and can't be bothered. Changes in energy and fatigue and loss of energy on most days is a really common symptom of depression. The last set of symptoms we were talking about associated with depression are thinking symptoms. So often with depression, people struggle with feelings of hopelessness and helplessness, worthlessness, excessive or inappropriate guilt, and the thoughts that go with those, hand in hand with those feelings, are really prevalent. So oftentimes people are going to express how, like, they think others don't like them. They think their situation's never going to improve. They may express they think that they're a burden on other people. They might talk about how they feel guilty or responsible for situations that are completely outside of their control. Another thinking symptom has to do with poor concentration. Depression can really affect our ability to focus and to pay attention. And this causes us to feel like we can't remember well. Maybe we even worry that we're starting to have a memory disorder. And people have more difficulty with problem solving. So, you know, when you're trying to get yourself to feel better, but yet you can't see your way clear because your problem solving is impaired, you're in a pickle. The last symptom of depression has to do with recurrent thoughts of death or possibly thoughts of suicide. People feel so badly that they want their pain to stop. And that's a very serious symptom. Now, to be diagnosed with depression, a person would need to have 5 or more of all these symptoms present for more than 2 weeks continuously. And having these symptoms for a diagnosis, needs to be a change from how that person is typically. So it's a shift from how they typically or usually are. Now, sometimes, you know, people talk about acute bereavement, and, you know, when you've had a significant loss, that first few months looks very much like depression. It feels like depression, but it's not considered depression. It's considered normal. It's only when we get outside of those months and you're still having symptoms that you might want to talk with somebody. I'm going to ask the moderator to actually move down a few screens. I got them. One more. One more. Sorry. Yep, keep going. I got them out of order. Sorry about that. Can you go down to the one that's entitled Geriatric Depression Scale? Yeah, there you go. So if you guys are interested, I'd like you to take a moment to self-assess for depression. So on your screen, there's a common depression screening tool. This is called the Geriatric Depression Scale. And in order to self-assess, I want you to start by thinking about how you've been feeling recently, just over the past few weeks, not from a long time ago, just right now. And I want you to kind of read each of the questions and give yourself either a yes or a no. So starting with question number 1, are you basically satisfied with your life? Yes, no. Number 2, do you feel that your life is empty? Number 3, are you afraid that something bad is going to happen to you? Number 4, do you feel happy most of the time? Number 5, have you dropped many of your activities and interests? Number 6, do you often feel helpless? Number 7, do you feel that you have more problems with memory than most? Number 8, do you feel full of energy? Number 9, do you feel that your situation is hopeless? And number 10, do you think that most people are better off than you are? Now, to score this, I'd like you to give yourself 1 point for each response that is darkened and in capitals. Now, if you score over 3, this is an indication of depression. And I would recommend that you discuss this with your primary medical provider. If you're answering yes to many of these questions, like 5, 6, 7 of them, you may want to directly go seek out a mental health provider. Now, whenever I give a talk on depression, I feel that it is important to talk about suicide. And sorry, moderator, this is where I got my slides mixed up, so we need to go back up. There you go. Thank you. I feel like it's important to talk about suicide, especially when talking with older adults. It is really a common misunderstanding that the age group that is most vulnerable to suicide is teenagers. That is not true. In fact, the most vulnerable age group is adults over the age of 75. People 85 and older are most at risk with a suicide rate twice that the national rate. So, over half of people who commit suicide saw their primary care provider within a month of their passing. And of those, 20% of them saw their doctor within 24 hours of their death. It's important that we talk about it. Risk factors for suicide include being male, having a chronic or a terminal illness, social isolation, financial strain, bereavement, depression, alcohol or drug abuse, a personal history of suicide attempts, or a family history of suicide. Now, if you're having persistent or recurrent thoughts about suicide, it's important that you seek help right away. If you or someone you know has a plan on how they would harm themselves, if they intend to follow through with that plan, help needs to be immediate by calling 911 or going to your local emergency room. If you know someone or you are having suicidal thoughts, you don't have any plan on how you're going to do it, it's really not something you want to do, you have no intention to follow through, it's still important to get help quickly because people can be impulsive and just make decisions that they wouldn't want to make otherwise. Now, there is a suicide hotline number provided on the screen at the very end, and you can go ahead and copy that down if it's important. But it's important to make an appointment to see your primary care provider or a mental health provider really within a short time frame if you're having these thoughts. Many mental health agencies have walk-in or crisis services where you can be seen that day. So the good news is that depression is treatable. The right treatment can help to improve your overall health and your quality of life. Many people begin to see improvements as early as 2 weeks from the start of therapy. It may take several weeks before you feel a full and more robust effect. The primary treatment for depression is medication in combination with psychotherapy. And, I think when I talk with people, oftentimes you say psychotherapy and they think about like in the movies, laying on the couch, talking about your childhood and all that kind of stuff. And yeah, that doesn't happen so much anymore. Psychotherapy is also often called counseling or talk therapy. The most current common form of therapy right now, psychotherapy, is cognitive behavioral therapy, or CBT. And CBT focuses really on challenging and changing what we call cognitive distortions. These are thoughts and beliefs and attitudes. And it also focuses on challenging and changing behavior. Improving what we call emotional regulation and our ability to be able to modulate our emotions, and the development of personal coping strategies, resiliency skills that we talk about that really target your current problems. Now, when I added this in the bottom here because, if you go online and you look up treatment for depression, you will see mention of things like ECT, or electroconvulsive therapy, or TMS, which is transcranial magnetic stimulation. These are treatments that are used only when depression is really severe and it's not moving in a positive way with other treatments. They're kind of like the last, they're not used as commonly. So I wanted to spend time today on those complementary or self-help strategies that really help us with depression. We often refer to these as resiliency skills. And moderator, I don't have a slide for this, I'm sorry. So don't be looking for it, thanks. So these self-help skills, they really have to do with taking care of your body and improving these resiliency skills that help our mind to heal, help our body to heal, and help us feel good. And I'm going to talk a little bit about these some. And, you can think back a little bit about, when we started this talk, we were talking about the pandemic and how, part of the issue with the pandemic is the stress and the isolation, but part of the issue too is that these resiliency skills that we do and use without really thinking about, or how much they impact our lives, got kind of washed away for many people. And then you don't have that support in your daily life kind of holding you up and helping you to be more resilient in coping with stress. So number one is exercise. And I know that my patients always say, oh, Laura, seriously, more exercise. Everyone tells me to exercise. There is a ton of research showing that regular exercise helps to improve mood. It produces changes in your brain chemistry. There's no getting around it. Now, I want to say, you don't have to go at this in a super intense way. I date myself when I say to people, you don't have to be Richard Simmons or Jane Fonda. You know, um, even mild but regular. So mild but regular exercise can produce change. So we're talking about taking a walk every day, taking time during commercials, like you're watching TV, the commercials come on, stand up, stretch, walk to the kitchen and walk back, you know, do some gentle stretching. This counts, this works. It's really important to remember to start from where you're currently at when it comes to your physical ability. I'm not going to start here and expect myself to be performing like an Olympic athlete or something like that. We want to really focus on beginning where you're at and making small, consistent changes. So, for example, I had a client once, she had bad knees, but she started walking just in her house. She had a circuit in her house that she would walk. And she started off walking, and I am not kidding you, 1 minute, continuous walking for 1 minute for the day. That's where she started. That's where she was at. And she slowly, over time, she increased her walking every day over the weeks and months. And she was walking 2 and then 3. And eventually she got up to where she could walk 15 minutes without stopping. Now, this was a huge success for this lady. She had real difficulty with her ambulation, but that walking really helped her feel much better with her mood. And it helped also to build up her strength and her confidence in herself as well. So number 2 on self-help tips is relaxation training. So examples of this would be deep breathing exercises, progressive muscle relaxation exercises, yoga, meditation, mindfulness breathing. There's a lot of resources on the internet about this. You can find apps on your phone to do mindfulness breathing. Number 3 in our self-help tips is to spend time outside and get plenty of sunshine. There is a lot of research on how sunlight and nature affects our mood in a positive way. Getting plenty of sunlight also really helps to regulate our sleep and to improve our vitamin D levels. That helps with energy and health, wellness, and well-being, feeling well. Number 4 on our tips is about challenging negative thoughts. We were talking before about cognitive behavioral therapy and about how some of the symptoms of depression have to do with this kind of negative, hopeless, helpless, worthless kind of mindset that we get stuck into. And when we're depressed, we engage in this kind of thinking more frequently. So examples could be, I'm no good, no one likes me, I'm never going to be okay, I'm never going to be myself again, I'm never going to be well, I'm just a burden. The hallmarks of this kind of thinking is that it's unrealistic and typically it's pretty self-critical. And this kind of thinking can become an unconscious habit that reinforces depression. So learning to recognize and to challenge this thinking, this negative thinking in a self-compassionate way is a huge part of what cognitive behavioral therapy is all about. Healthy tip number 5, eat a healthy diet. What your doctor has been telling you all along is true. What's good for your heart is good for your brain. So sugary, salty, high-fat food is oftentimes what we reach for out of convenience, like if we just don't feel like cooking. But we also reach for it for comfort, But it causes spikes in our blood sugar, creates mood instability, weight gain, that all of that reinforces low mood. Also, it's important to recognize that some vitamins in our diet really are protective of brain and brain health. So it's important that we get what we need from our diet to make our body function well, make our brain function well. Healthy tip number 6 is adequate sleep. Sleep is vital for the brain and the body to repair and renew itself. Having good sleep improves health and our overall energy levels. Sleep can be a huge challenge when we are depressed. So if you're practicing good sleep hygiene, maybe you've talked with your doctor about that, and it's not helping, then this is where medications can come in and be helpful. Tip number 7 is to stay hydrated. We don't often think about hydration when we think about mood and brain health, but when we get dehydrated, it really can have a negative effect on our ability to think clearly. And it's very important for brain health. Healthy tip number 8 is to make a change in your routine. When people get depressed or they're feeling low, we kind of get stuck in a rut and we get that blah feeling and we're not, we don't want to do anything. But I really would challenge you that even if you don't quite feel like it, try to start doing some of the things that you normally enjoy, but you've stopped doing them. Most people tell me and they say that once they start engaging in an activity, I don't feel like going out with my friends, but I make myself go out with my friends. And then by the end, I had a good time. I actually really enjoyed myself. We accumulate positive emotions by doing things that are pleasant, not big, huge things, little tiny things that all add up and accumulate. So try and think about making a commitment to a health change, doing something pleasant, a change in your routine, and again, start off small. It might be that instead of letting the dog out in the yard once a day, you take him for a walk. You might decide to have your morning coffee on the porch in the sun instead of inside in your dark kitchen. If you're thinking about cleaning up the house, maybe think about starting with just taking out the trash or doing the dishes and not like trying to get the whole house clean in one day. Healthy tip number 9 is to have some daily structure. And I think this is where the pandemic hit a lot of people hard, and actually when people retire, this is a challenge and a struggle. Research shows that having a simple daily routine helps us to alleviate stress, and that helps to reduce depression. And it doesn't have to be complicated. It doesn't have to be rigid, like I will eat breakfast at 8:30 in the morning and nothing else. Just a loose, simple routine that you kind of follow every day, kind of structure your day around is really helpful. Healthy tip number 10 is to increase your social contacts. Spending time with loved ones. Don't isolate yourself. This, again, is a huge challenge during this COVID pandemic. And, I encourage you to take safety precautions when it comes to COVID transmission. Absolutely. Our vaccines, masking, having distancing, when we do see people, all offers us protection. And so we don't have to be completely isolated, withdrawn, and offline. If you're feeling safe and protected, go back to church, meet with your friends and family in a safe way. If you haven't been engaging with people for a while, it can feel really awkward, and that's okay. It'll get easier the more you do it. It's just like riding a bike. You'll get back into the swing of things. Healthy tip number 11 is to increase laughter as much as you can. You know, laughter increases endorphins and it helps to make positive brain chemistry changes. Um, Watch funny comedy shows, watch silly cat videos on YouTube, get together with your friends, tell jokes, tell funny stories, kind of try and engage in that pleasure and in being able to laugh. Healthy tip number 12 is to help other people. Now, this seems like, wait, we're talking about me and my depression. Why am I going to be going doing stuff for other folks? When we are depressed, we often have a really hard time seeing beyond how we feel. We get really turned inward. And by doing helpful things for other people, for animals, nurturing your plants in your garden, you know, all that kind of helpful nurturing behavior, that gives us a break from those depressed feelings. And it helps to build a sense of self-worth and of what we feel, what we call mastery, that we can be helpful, the opposite of the hopeless and helpless and worthless. You know, my last self-help tip here is about practicing gratitude. And, you know, as human beings, our brains naturally are geared to look to for problems and want to fix them. You know, we want to make sure everything is going according to Hoyle. You know, and when we get depressed, we get so overwhelmed by all of our problems that we often feel like we are unable to make any positive headway or any positive change in our life. And with all of this negative focus, we often really overlook the good things that we have in our lives. Practicing gratitude is about taking time every day to actually sit down and list, to think about all the things in your current life that are good, the things that are going well. You know, this makes me think of a lady that I saw years and years ago. And she was always really struggling with the focusing on the negative. Everything was negative. And when, you know, the group would ask her, you know, what's good in your life? What's good today? And she, nothing's good. Everything's bad. And they really challenged her on this belief. You know, they discussed how, you know, hey, you got running water in your home. You took a hot shower this morning. You have heat. You have central air. Like, it's comfy in your house. You have indoor plumbing. You don't have to go to the outhouse. Now, this led to a really great conversation because many of the people in the group, this person included, had grown up during the Depression. They had grown up in a time when they did not have these modern conveniences that we just take for granted and that she was taking for granted. And this discussion was really a turning point for that person. They began a daily gratitude practice and found that, as she put it, I really have many, many blessings in my life. And I just couldn't see them because my depression blinders were on. You know, this change in thinking can really help us significantly when it comes to recovery from depression because we get those blinders that come on us with this disease. So we've talked a lot now about how we can help ourselves if we're struggling with depression, and then people often ask me, how do I help somebody else with depression? Like, you know, my mom's depressed, or my sister, or my friend, my brother. You know, the first thing is to help them to seek treatment, either with their doctor, start there, with a mental health provider, start there. You know, with many older adults, transportation can be a barrier to treatment. So, you know, we're talking about working with older adults, then we want to make sure that they have a way to continue to get to their appointments. Offer support, offer encouragement, understanding, and most of all, patience. Your patience, and encourage their patience. I think as people, we often want to fix things quickly and we want to move on. And we don't want our friend, our person, our loved one to hurt. And we want them to be okay. And, we have to remember that, recovery from depression takes time. I often tell patients, it took you a long time to get to this place. It took you a long time to realize that you needed some help, and it's going to take us a while to unravel this and kind of get you back to where you're feeling good again. You might want to offer to keep track of appointments for this person or to help them with their weekly pill box. A lot of times older adults with depression can struggle with thinking clearly. Remember that concentration problem is a symptom of depression. So keeping on track and making sure is those things is important. Invite this person to outings, to go for a walk, to have a cup of coffee. We know from our discussion about self-help for ourselves that being with other people, having some exercise, engaging in activities that bring pleasure are all helpful with depression recovery. Never ignore or shy away from comments about suicide. Sometimes we just get afraid. Like if someone says something, we're afraid that if we actually talk to them about it, that it'll make them more apt to do it. And the opposite is actually true. We need to engage in those conversations if they're bringing it up. And, if they're bringing it up, you need to talk with them, talk with their doctor, talk with their mental health provider, that, this is what Joe's saying when I talk to him, and I need to let you know. Lastly, it's important to remind that person you're supporting that with time and treatment, that their depression will lift and they're going to feel more like themselves again. That we can hold on to that hope and remind them of that. So going back to our discussion about suicide earlier, you'll see up on your screen here, there's the suicide hotline number. If you feel like you need that, you could write that down. So if you have an immediate dangerous situation, you want to call 911 or go to the emergency room. You can seek help through primary care doctor, specifically to discuss depression, or make an appointment to see a mental health professional. Now, here at the Center for Senior Renewal, we offer we are what they would call a group therapy program. So I'm going to take a minute to talk with you about us. So we are a mental health program specifically for older adults. So seniors often face unique emotional problems that can make life abnormally difficult. Some of these programs include difficulty coping with life changes. Hey, Kayla, can you switch my slide? Up one more. Oh, there they are. Cool. Difficulty coping with life changes, trouble adjusting to retirement, deterioration of daily living skills, loneliness and isolation, debilitating problems with grief and loss, feelings of anxiety and depression, adjusting to declining health, negative changes in eating or sleeping habits, strained family relationships, especially if we're having physical problems and other people are needing to come in and help us out, that can lead to tension and stress. Sometimes people will have a strong sense of hopelessness that is accompanied by thoughts of death or with suicidal thinking. We really face a lot of stressors as we age. One of my patients from long ago, she used to always say, "Getting old ain't for sissies." And she would encourage the other people in the group to really talk about what was going on with them. what we offer at Center for Senior Renewal is individualized group therapy with other seniors who are struggling with similar issues. I think it's really important for people to talk with other people their same age who are having their same difficulties. And it really gives you a lot of support and to realize that you're not alone. There's really a lot of other people going through what you're going through. We offer individual counseling and family therapy, as well as medication management with physician supervision. Our psychiatrist is Dr. Qureshi. So treatment really begins by calling the center and scheduling a free and confidential assessment with a licensed counselor or a social worker. And we can do that interview either at your home or here at the office. Some people prefer the privacy of their own home. Other people, they want to come in and see the program and see if, how it is and, look at the building and all of that. In the interview, we discuss your current concerns and the symptoms that you're having. And we determine if you meet the Medicare criteria for the program. We are a Medicare-based program. And, most importantly, though, in that interview, we want to determine if you feel that our program would be a good fit for you. So if you and the therapist both agree that the program would be a good fit, then we would go ahead and make an initial intake appointment with our psychiatrist for further evaluation and admission to the program. Most people start off coming to the program 2 or 3 days out of the week. And then as they get better, their time here decreases. So they might start off at 3 days and then as they're getting better, move down to 2 days and then move down to 1 day a week, 1 day every other week until they graduate from the program successfully. I think now it's time for any kind of questions or discussion that we might be able to have.
Well, wonderful. I really appreciate listening to you. That was great, Laura. I love the tips. I wrote them all down. Somebody's going to help me make them a Facebook post, okay?
Okay.
We need to do that. And I have to challenge Kayla. Do you know what she meant when she said, according to Hoyle? Do you know what that means?
No, I don't.
Okay, so we're aging ourselves against Kayla, but when you said blinders, Kayla knew exactly what that meant right away.
Yeah.
So kudos for her. But yeah, I actually have a book of Hoyle and Tracy. You know what they are, don't you? So, yep, I liked that little reference in there.
Like now, just so I'm on the right page, I was thinking it's card games.
Yes.
All right. Woohoo!
Yes. Yes, it's definitely all the rules to the card games that you have to follow. So that was a good one. And it met what we were thinking of. And I thought that would help alleviate our attitude here a little, to have a little chuckle knowing that Caitlin did not know that, or Kayla didn't know that, but we did. But you caught Kayla too. So we're all included here. And I want to say I am so grateful for you, Laura. What you are doing connects so well with what Second Act needs to be doing. And we see that our numbers are lower. People are out of the habit of doing things. Our things have to be done a little bit differently. So encouraging people to continue to get out to try and do a few of these things is what we're trying to do also. And we're trying to do it as safely as we can. All right.
Yeah, absolutely.
Kayla, do you have any questions for us? Anything come up in our chat?
Yeah, so I do have a question for you. A lot of people use anxiety and depression either together or they mix and match them. And so since we're focusing more on the depression side, kind of what in, a pretty quick sum up, what is kind of the difference between the two? And do they often go together? Can you have one and not the other? And kind of those things in a quick little snip.
Yeah, so in a quick little snippet, I often I joke with people that anxiety and depression are cousins and they like to hold hands. The anxiety and depression are both mood disorders. So if you think about depression is primarily focusing on sadness, where anxiety is primarily focused on worry. So you have more of that worry and fear underpinning in the mood part of the disorder. And they both have very distinct physical symptoms that go with them. So with anxiety, it's more about arousal. So things you think of in terms of like panic, where you're feeling your heart race and sweat and nervous energy. When with depression, it's more of the physical symptoms that we already talked about. So
Awesome.
more pushed down, sedated in that way. And very often anxiety and depression can come, they can be separate, but very often they are together because a lot of the thinking difficulties with anxiety underpin depression. You know, if we're having a lot of negative thinking patterns and a lot that increase our worry and our anxiety, it's also reinforcing and increasing depression symptomology.
Awesome. That's great.
Yeah.
I also had a question about getting to you guys with Senior Percenter Renewal. Do you need a referral, a referral to get to you guys, or can they just call the number, or how does that kind of work?
They can do it either way. They can talk with their primary care physician and the doctor can make a referral here, or they can refer themselves. You know, they don't need, you know, with Medicare, you don't need like a pre-authorization from your primary care, so you could just call yourself. Yeah. One of the things I do ask though, like, is if you're calling for someone else, that you've talked with that person about the fact that you're calling here for them, because I'm going to end up calling them and be like, hey, so and so referred you to the program and blah blah blah, and they'll be like, what? You know?
Yeah,
Yeah.
that would
So
be a confusing phone call if you didn't know what's coming.
yeah, it makes for an awkward cold call.
Yeah. Also, I had one other question, and this one I'm not sure you'll be able to answer, but you might. Do you often see that most of your clients end up on medication? If so, you know, do you guys prescribe it there? Do they get that from their primary care physician? Are they already on medication? Does a switch of medication help sometimes? Those kind of things.
Yeah, the answer is yes to all of the above. So, you know, medication is a really personal decision, and it's a decision between you and your doctor. You know, I have had patients that have only done therapy and not had any medication whatsoever. I have patients that come in with their medications from their primary care, and they see the psychiatrist and he says, no, you say you're good and it's all good. Doctor might make recommendations for changes in medication. You know, the one thing that I would have to say when it comes to medications and with older adults is that it is important for the doctors to be careful. You know, and then they typically, I think that's one of the reasons why it's good to have a psychiatrist involved, at least to give an oversight or a look-see, because you know, older adults can be more sensitive or, you know, have different reactions to medications, and they tend to be on some people are on a lot of medications, and then you increase interactions and have negative effects from medicine. Or maybe you're just physically, because of the changes in your body with aging, not tolerating a medication that used to work for you, but now it's not. So at least having a discussion with the psychiatrist is good in that way, so that you're more educated about making those decisions for yourself.
Great. I love that answer. You know, each person's different, and
Yeah.
over time we always change. So
Yeah,
those
they
are all
change over
the
time. Yeah.
those are all the questions I really have. So I'll give it back to Kelly.
All right. And I do think that's a good point, Kayla. All of this is about you as an individual,
Yeah.
not comparing to someone else. It's how you feel, how you perceive things, what you're feeling is important. And we definitely want to acknowledge that.
Yeah.
I did come up with one thought. Laura, as you went through your tips, tip number 7 said hydration. And you
Yeah.
kind of left it at that, but I see Kayla's taking a sip and you're taking a sip. what would be appropriate things for hydration?
Well, water is always best.
Yes.
Staying away from sodas and lots of caffeine is good. Um, there's a lot of ways that they make, water fun these days where like if you just don't like ice water, you can jazz it up with fruit or the little drink things that you can pop in your water bottles, all that kind of stuff. But yeah, our brains, our brain likes sugar, it likes sugar, it likes to be fed glucose, and it likes to be hydrated. And if it doesn't get those things, it's just not working well for you.
Okay. I really wanted to push that water, and I wanted to make sure to say drinking coffee all day is not the solution.
No, not at all.
Tracy, I'm so glad you could join us. Did you have any questions?
Well, I do actually. I'm like you, Kelly. I was like writing down all these tips, and I was actually putting a star by the ones that were like, oh my gosh, that's me.
Yeah.
And like so many people, I think it's so hard to pull the trigger and come and make the call to you guys and make the call to ask to reach out for help. How do we get folks over the stigma of it's okay to reach out? You shouldn't feel bad about it. These are here to help you, and like you said, being a senior isn't for sissies. So
No. No, and treating our mental health is no different than you would treat your hypertension or your diabetes or your knee pain. Like it's a difficulty, it's a disease within your body, and it doesn't have to do with your strength, it doesn't have of character, it doesn't have to do with your spirituality, it doesn't have to do with any, well, spirituality is a positive thing, but it's not that you're a bad person per se, it's that you're struggling right now with some biochemical changes and
yeah,
and
or
stress.
it's not a weakness either. You're not less of
Right.
a person because you need help with something like this.
Yeah, we all need help, We were made to be in community with one another. We all need help at some time in our life.
Yep. Very well, very great presentation.
Thanks.
Very pleased. I am so glad that you were able to join us today, seeing how it is National Mental Health Day. We want to promote that. We want people to be aware of this is not some I'm hiding out in my room in the dark, I'm going to sleep all day. This is we need to be out there. We need to get some sunshine. We need to get a little exercise. We need to enjoy life, be a part of living our lives. And if that helps to have a little therapy or a little medication, we would do that for our health in any other area. So why would we not do it for our mental health? And so I really am glad you could join us today. Kayla or Teresa, any other questions? All right. Well, I do really want to thank you, Laura. It was a pleasure
You're
to meet
welcome.
you. We actually got to meet in person at the senior day for
Mhm.
Murfreesboro Apple Fest. So it's nice to see you again, even though it's not in person. For all of those who have registered for our virtual classes, we are now still doing a drawing, and we're going to send a little swag out to someone. So we'll let you know who won from registering for today's program. All right. Kayla's going to send that survey. We need to hear back from you. We always want your input. Please tell us, what do you like? What don't you like? What would you like us to do? If you want Laura back in another month, I'm sure I'll ask her again. We'll bring her in another time. All right. And do be aware, she mentioned about exercise and little steps. We do have room in our Enerchai class tomorrow. You can come for $5 and give it a try. It's like doing Tai Chi. It's the movements and the actions that are really going to be helpful for you. We also have our Boom Move It class, our stretch and toning class coming up, and we're also going to have a Pilates class. So we need that exercise. We need to get out and we need to do a few things. And like I said, our November newsletters should be coming out in the near future, and we'll have a couple more designated destinations. So a couple more chances. We're going to do a hike, and you can get outside again, and we'll combine that sunshine and having a little bit of exercise. So we're trying to do these things, Laura. We really are, okay?
Good. Awesome.
All right. Thank you so much for joining us today. Everyone, take care.